Since 2020, Tanya has provided a place to call home for 26 children and youth. Let's hear more about Tanya's story in today's Foster Care Spotlight. Tanya grew up in the foster care system and lived with several families. After having children of her own, they were unfortunately placed into state custody when she struggled with addiction. This saved her life and she turned her life around. Years later, she and her husband William became kin caregivers for his grandchildren, and they eventually became foster caregivers for others. She knew she wanted to give back and that she could give other kids a family and a home, a healthy one at that. Tanya has turned her passion for mental health into a career and works as a behavioral health case manager and family support provider. She advocates for teens in foster care and says they often get left behind. This National Foster Care Month, Tanya hopes to spread the word about how important mental health support is. Too many people assume a child will thrive once they end up in a foster home. But Tanya wants people to know living with strangers and new routines can be hard for a foster child or youth to adjust to. She wants foster caregivers to work with their caseworkers, agencies, or community mental health organizations to support youth in foster care early and regularly. Tanya has been through a lot with her children, from hard times like the loss of her husband to exciting times like her oldest adopted daughter attending college. She believes being a foster parent is a blessing and doesn't plan on stopping anytime soon. Advocates like Tanya are a big reason why we expanded our behavioral health services. As a Virginia Medicaid member, you can access services like therapeutic day treatment, mental health skill building, mobile crisis support, and mental health case management for youth and adults. To read more about behavioral health services and read Tanya's full story, go to the links in our bio.